Please welcome broadcaster and UN Goodwill Ambassador James Chau with Dr. Keiji Fukuda of the World Health Organization and Dr. Seth Berkley of Gavi.
Hello everybody, I'm James Chau and thank you for your time. I want to start off by asking a couple of simple questions. How many of you, and raise your hands, have ever taken an antibiotic when you were sick? I think that's almost all of you. Keep it up there, keep it up there, keep it up there. Okay. How many of you, when you took those antibiotics, haven't finished all of your pills because you thought you're already feeling better? Okay, good fair proportion of you. Keep them up. Because you're already feeling guilty right now, so I'm going to push it one more level. How many of you, you didn't finish those antibiotics, you kept them in the cupboard, and when you were sick later on, you used some of those leftovers? Some of you here said, oh yeah. Okay, so I'll take that as a yes. This is the question I really want to ask you. How many of you have ever heard of AMR? There's very, very few people. Welcome to this session here on superbugs and microbial resistance. Over the next couple of days, there are going to be 3 high-level meetings here in New York. One on refugees, one on climate change, and one on AMR. Dr. Keiji Fukuda, you're from the World Health Organization. Start off by this. Tell us, what is AMR?
So we have this big problem, and it's really a big problem, which is going on around the world. Basically, we are losing our ability to treat infections, to stop infections. And there's a couple of points I want to emphasize about this. We are seeing this everywhere, and we're seeing it to an extent which is compromising care. We are seeing this to an extent that this is now something which has to be talked about at the level of the General Assembly. But maybe most important for everybody to know is that this is not an esoteric problem. This is an everyday problem. This is for people who have urinary tract infections, for anyone who gets in a hospital, has a tooth abscess. This is for anyone who has to go in the hospital because they're thinking maybe they need surgery or they have cancer. So this is not an esoteric problem, and that's basically what we're facing.
Keiji, I want to put this into numbers. This is happening right now, not tomorrow, not the day after. 700,000 people are dying each and every year because of AMR. And that number, if nothing else changes, is going to hit 10 million by the year 2050. Personalize that for us, Dr. Seth Berkley of the Gavi Alliance. Think about your father, think about your children. How have things shifted?
Yeah, thank you. Let's talk about this. So my grandfather died of a strangulated hernia. Now, when I grew up as a kid, that didn't happen. If you were as unlucky to have your gut twist, you'd do surgery, but you'd also have to give antibiotics because of the infection. And today, if you have resistant bugs, you might not be able to treat that with antibiotics. So the 2 great changes in medical care that occurred during this last century are the creation of these very powerful drugs, but second are vaccines. And if you look at what's happened there, my father had 1 vaccine, smallpox. I had a handful. My kids have more than a dozen. So what we've done is we've created these powerful instruments that can be used to prevent infections. And if we get them out, then we can reduce antibiotic use.
This is another reason why this affects you. When you're having heart surgery, hip replacement, if you have gonorrhea, if you have a cut that then becomes infected, that's why AMR relates to you directly. It also matters to you if you eat. If you eat meat, especially because food producers today are using antibiotics to treat animals not only when they have infections, but also to make them grow faster, so life becomes more profitable for them, but also in many ways to stop plant products from growing mold. Let's talk about meat and how directly it affects each and every person sitting in front of us and watching us.
So in terms of volume, in the US, about 80% of the volume of antibiotics that are important are actually used in animals. And as you say rightly, James, this is not to treat infections, this is to affect growth. And we have to put this into perspective. At the beginning of the century, about 5% of people living in developing countries were in urban centers. Now that is going up to more than 50%. And even Africa, which now is about 40%, is going to go above 50% in the next decade or so. And with that, there's a huge desire as people get wealthier to have more meat. And so there's the pressure on the system to use these type of antibiotics.
So we've established that it's urgent. Keiji, you have a young family of your own. I know that you wanted to be here specifically to talk about solutions. What can young people do today, especially with the power of social media, to demand a change in what they buy and what products they see on their supermarket shelves?
Yeah, thanks, James. First thing is that this is an issue of today. It's not a theoretical issue. And I think that's one of the things I want people to understand, that it is occurring everywhere in small towns and in big cities. The second thing is that people are simply not aware of their ability to reduce this problem and address it. For example, when you go to a doctor's office, if you don't pressure the physician to give you antibiotics, that's taking a step towards reducing driving these pressures to increase resistance. If you let your feelings know about what kind of food you want, do you expect antibiotics to be in them? Do you expect perhaps resistant pathogens to be in them? And I think that making this kind of voice heard is where younger people are going to change the world.
You make that change by demanding. You make that change by not buying. Your purse, your wallet is where you hold that power. Keiji, I want to stay with you because I want to find out, how do we make what we've got last longer and stay effective? And I know we talk about the 4 Ps. If you look at pharmacists, people, physicians, policymakers, where do they come in?
Yeah, so all of these groups, all of these people have a role to play. So we're going to have policymakers meet next week. The top-level policymakers meet next week in the world. And the first thing is for them simply to recognize that we have something which is genuinely a global societal issue. This is beyond a health issue. We need them to also recognize that funding is going to be needed, and we also need them to recognize that we actually have a lot of the tools and information needed to do what needs to be done. What they have to do is allow those to go forward. We need pharmaceutical companies to understand that they have a role in this. Part of it is that we're having resistance go up. Part of the problem is that we simply don't have new medicines and coming online.
I tell you how long it's been. I think we discussed this. It's been over 20 years since there was a new antibiotic. But Seth, we open up the papers, we switch on our iPad, we can see headline stories about new potential cures, advancements towards cures for cancer, for Alzheimer's, even for HIV and AIDS. But I don't think I've read anything that's talked about a new antibiotic. How are we going to convince and incentivize pharmaceuticals to invest in these?
So before I get to that, I want to make sure that the audience knows about one very important fact, and that is, believe it or not, bugs have sex. Now, the reason I say that is it isn't only having your meat with antibiotics in it that you might get exposed to, but what happens is the bacteria that exist in those products, they can transmit the resistance to those antibiotics, and that's how it spreads. And so we need to keep that in mind, because it isn't just the antibiotics, it's then the bugs that get spread and move around the world, because you can have, as you know, breakfast, you have dinner in Nairobi, you have breakfast in London, and you have lunch in New York, and that's within the time that these can be spread. But to answer your question about incentives, the critical issue is that if you wanted to create a new class of antibiotics and use it properly, you don't want to use it for large numbers of population. You only want to use it for resistant infections, at which point the market is very small, even though it could be used worldwide. So what we have to do is build incentives as if this is an orphan drug. And we have done that before with vaccines. There's things like advanced market commitments and ways you can top up the support for these products to make them profitable for pharmaceutical companies.
I have to quickly ask you, those bugs, is it good sex?
Well, I mean, from their perspective, it's very good sex because they spread them all over the place. But the challenge is not to get those resistant organisms.
I think there's a word for that. I think there's a word for that. I want to ask you, Seth, about looking ahead, creating a system a model for funding mechanism to invest in the development of antibiotics so that the cost of R&D is not tied just to price. So it's accessible to everybody who needs it. So it's affordable to those, and also at the same time, because I think it's always important. And you know, whatever you do, whatever cause you herald, don't just think about your cause. Think about the people that you're trying to get help from. How is it going to be an incentive for companies to develop new antibiotics so that you don't need to go there with a begging bowl? They want to do it.
So let me give an example of what we did. So the pneumococcal organism is the main cause of pneumonia in the world. And pneumonia is the largest killer of children in the world. Today, about 800,000 kids under 5 die a year of this. So there's a good vaccine. That vaccine is very expensive. It costs about $450 a year here in the US. What we did is we worked with those companies to create an advanced market commitment. We said, we will give you funding, a long-term commitment, which is what they need to get their volumes right. And we'll not only pay you and make a commitment, a legal commitment, but we'll also give you a top-up for your shareholders. So you can go back and say, I've amortized those research costs into this guaranteed payment, which is a good thing, in exchange for a reasonable price. And that was to try to get it to poor people. Mechanisms like that can be created for an antibiotic where you can sell it at a reasonable price, you can make a reasonable profit margin, and you can keep it restricted to just those who need it.
So, yeah, I want to add on to what Seth said, because I think part of the problem is how we're going to juice up the system so we actually have the new drugs coming along. But the other flip side of it is right now for big parts of the world, the bigger problem is they don't have access to those medicines. They simply can't get antibiotics. The health systems don't work, they're too expensive. And this is part of the real world puzzle that we're going to have to fit together. How do we make more antibiotics, but how do we make sure that they can get to people who need them?
I want to transport this to everybody watching here in this room and on the net right now. Wednesday, there's going to be a one-day session on AMR. What do people need to look out then and after Wednesday?
Okay, so what we need to look for is that this is really a historic moment, and you should understand this. Infectious diseases, up until the last century, what killed all of us more often than anything else. That was the killer of people. We drove that down because we had cleaner water, we started addressing poverty, and the things which Seth mentioned, vaccines and medicines, came online. We're now beginning to lose those medicines, and this is going to set us back. In our lifetime, we've had health workers putting out warnings, we've had lots of guidelines and studies, but we haven't been able to reduce it. But what's happened now in the past few years is the discussion has broadened. We now see the economic impact of it. We see that this is going to set back development, and we see that this also is going to set back our ability to have enough food in the world. It's a very fundamental issue. The presidents, in recognizing that, can change that. They can put in motion what needs to be done.
Keiji, I heard that your two daughters, so I think about 2023, like many of the people here in this room, they're here somewhere as well. When you think about your daughters and now, what is the best future that we can give them?
This is one of the issues we have to address. Again, I want to drive home. I've dealt with a lot of bad things in my life, big outbreaks, lots of infectious diseases. This is the problem which is going to go up, and it is going to literally affect my kids. It's going to affect all of you in the room, unless we take steps now to begin to bring it down. This is not going to disappear on its own.
Mary Robinson, and we heard her just then, and she said it to me over a number of years, that this is not going to affect her, climate change. This is going to affect her children and her grandchildren. This is not at all to belittle the huge and tragic impact of climate change, but as Keiji said just there, this is not happening to your grandchildren. This is happening right now. Keiji Fukuda, Seth Berkley, thank you very much, and thank you to all of you for listening.